Hello and welcome to this video about rosacea. So rosacea is a dermatological condition of a reddened face. So it's an autoimmune condition which leads to reddening of the face with these symmetrical red discoloration of the skin tone, as you can see in this patient. So there is a flushing and persistent redness. In fact, a lot of these patients, the redness can stay for hours, and this is known as transient erythema. So they have this symmetrical transient erythema around their nose, around their cheeks, and the forehead and the chin as well. So this is this transient erythema which occurs in rosacea. It commonly occurs due to an autoimmune skin condition, and it commonly affects females. There's a few other causes of rosacea, which includes mites, which are these Demodex mites. So these Demodex mites have been linked to excess rosacea. When we studied the pattern of the skin in patients with rosacea, they found a lot more mites in their skin. So do mites cause rosacea? Yeah, they do, especially Demodex mites. Other factors that can lead to the development of rosacea is genetic factors, environmental factors, and one of the most important environmental factor is UV radiation. So UV rays and photo sensitivity to the sun, but that is more of a trigger. Now, we can get different types of rosacea, but the pattern that rosacea follows is typically episodes and remission. So the patient might have episodes of rosacea, then they might undergo a period of remission where they have no further episodes and no symptoms. The clinical features, as I said, is this erythema on the cheek area, an erythema on the chin, and it's always going to be symmetrical, and this erythema is going to be transient. They may also have episodes of flushing. Flushing is when the skin undergoes a bright redness, okay, and this is more common with people who are younger age. Now the erythema is redness, and that can kind of stay, and that can be more long lasting as well. Now, a lot of people think that rosacea stops at just the erythema, but actually these are all the other findings of rosacea. You know, it can present with these bumps and pimples, which is a more severe progression. So it can present with these bumps, persistent facial redness with papules and pustules. Papules and pustules. Remember, papules were kind of like a raised lesion that were less than 0.5 centimeters, and pustules were these enclosed cavities of raised lesions filled with pus, and those were our pustules. Then we also have a skin thickening around the nose. So this enlarged nose is called phymatous changes. That's seen in rosacea. You get this enlargement of the nose, and it's quite obvious. These patients have this much thickened skin around the nose. This is known as a phymatous change, phymatous. And lastly, these patients can also present with eye irritation and ocular changes. They'll have bloodshot eyes, burning of the eyes, stinging of the eyes. This is known as ocular rosacea. So this is ocular rosacea. There's other symptoms like iritis, inflammation of the iris, keratitis, conjunctivitis, and blepharitis. Okay. Also, if you follow me so far, this phymatous change, especially of just the nose, that is known as rhinophyma. Rhinophyma. Remember, anything to do with the nose, like sinusitis, this is rhinophyma. It occurs due to hyperplasia of the sebaceous glands, which are found in quite a high density in areas of the nose. Now, moving on to a mnemonic for how to remember the types of rosacea. So the mnemonic is Pope. So just imagine somebody saying the Pope might cure your rosacea. So he's touching this girl's cheeks to cure her rosacea. So Pope, this is just a mnemonic, no religious reasoning there. So the Pope is P for papulopustular. So P is for papulopustular. O is for ocular, for eye problems. The other P is for phymatous changes, which was the thickened skin, which we saw, which would have been known as rhinophyma. So the first P was for papulopustular type of rosacea, which had papules and pustules, and here you would make a differential with acne vulgaris, the common acne. The differential there would be acne also has the presence of comedones, also ocular for O, P for phymatous changes, remember your rhinophyma. And the last type, which is one that we haven't discussed, is the erythemato telangiectatic type. Remember, erythema and telangiectasis can present in similar ways in rosacea. Telangiectasia is when you have dilation of the blood vessels right under the skin. So these capillaries and arterioles and venules get dilated right under the skin. That's known as telangiectasia. And when you have both telangiectasia and erythema at the same time, that is known as the erythemato telangiectatic type. And that's everything from me for today. Your treatment would be, you would treat by preventing these exacerbating and triggering factors like stress, alcohol, drugs, medicines, spices, and sunlight exposure and stress especially. Also sun protection, you wear SPF. Ocular erythema, inflammatory reasons you would causes you would